Welcome to Thinkin Bros. I'm Chris.
And I'm Alex.
We're your favorite corner store philosophers trying to figure out life one conundrum at a time. And today we have a guest of honor. A little bit of a backstory behind the guest of honor of today. So we actually met while he was a pickup artist. That's where he started, and now he's a medical doctor with countless years of experience. So we're honored to have him on today. Do you want to present yourself?
Yeah, hello. My name is Sam. I'm happy to be here, and I really wish I was a pickup artist. And I've had many years in medicine, but alas,
Yeah.
uh,
Well,
not old enough for that.
yeah, we're not very sad about the whole pickup artistry not working out, and what a fascinating story to transition from one to the other. But that's definitely for another time because today we're going to be talking about AI versus medicine. So my first question to you, Sam, would be, well, first of all, we're going to be trying to assess what AI developed to its maximal capacity means for the future of medicine and doctors, right? So realistically, its full potential will not be fulfilled during our lifetime, so your job isn't threatened by that. It will more likely be simply a tool in the next years to complement your work, right? Complex diagnoses, looking at blood tests and such. But what we're trying to push towards today is really imagine what the full potential of AI in medicine would mean. And my first question would be to you, what would be the difference between a newly graduated doctor out of med school and an AI? And to get to that, I would like you to try to categorize everything that a doctor goes through in med school, right? So if you were to start with categories like this, it would be, let's say you have to study all the diseases, right? So that an AI can do. So we can analyze it bit by bit, right? Or you have to study the effects and the uses and the history of all the medicine. That's definitely something an AI can do. Could you try to categorize it for us? What is a newly trained doctor? What does he get out of med school? I know you've trained some doctors, you've had some interns, so what do they have?
You're right about the fact that many things that a doctor can do and an AI can do because, well, the AI has access to the entire internet and is extremely fast at picking up the information. But if we go a bit uh, uh, like to see what medical students learn in medical school and what they get once they graduate, well, yeah, of course, they acquire the like medical knowledge, and it's a lot of people think that, oh, well, medical students after they graduate they know everything about every single disease imaginable, but unfortunately, that's just not feasible to do for a human being. Uh, as medical students uh, become doctors, they primarily learn about the most general diseases, the ones that they see the most, particularly in their region. For example, here in Canada, like we are not going to see as many uh, like diseases that pertain to like worms, let's say, as
Or like
a
malaria,
doctor.
right?
Exactly. We still learn about it. We have classes about it, but we wouldn't go as deep in like as deep into a subject as, let's say, somebody who is from China or like where tropical diseases are more prominent, or
Right.
like in Africa. But here we will learn more about like diabetes and other diseases that are more common in.
Right.
Uh,
So that is not to say they're not sophisticated enough. It's already an edge to, I mean, correct me if I'm wrong, but they're just people, especially fresh medics out of med school. They're newly, um, um, okay, let me rephrase that. They're just people who know where to look, but they know where to look competently, correct? In the
yeah,
same way that you
exactly.
guys have a database, right, where you to which you refer, and like only doctors can like interact and like update the database of knowledge. Whereas for me, it would be kind of like oh, I have a headache and my tummy hurts, I Google that on WebMD and get a certain answer. That is not a competent research. But what you guys do, what you have the ability to do, is even though you don't store everything in your brain, which is impossible, you guys can competently look for that, correct?
Yeah, and also just learning how to interpret various studies. Well, a lot of other professionals do that too in their particular fields, but for example, like the average person, they would read a headline that talks about a particular study, and then they just take the word of the person there that wrote the article, and they're like, oh yeah, well this is what the study says. Well, but the person who wrote the article, maybe they don't know as much as a doctor. Doctors know, like they know the terms better. They know what they mean. They don't like, for example, with right, we saw the a craze about mRNA. People were freaking out about mRNA, like, oh no, they're injecting that into our bodies. But like, as a medical expert, you learn that, well, it's just a normal thing in your body to have mRNA, and that's just an example.
Right.
But so yeah, like doctors, yeah, you're right. They don't know everything, but they're really good at finding the information, but also seeping through the information. Like, yeah, you can tell the AI, okay, my symptoms are, um, I have a headache, and I'm losing weight, and like, if, for example, you're a woman and like you have more blood during your period than normal, and an AI will instantly tell you, oh, you have cancer. Well, maybe not instantly, but that's what the internet says. And AI right now don't really know exactly how to differentiate between diseases that are really similar presenting, let's say. And medical students and doctors, like we still have problems with that, right? But it's like it's easier for us to like take a step back and try to figure out if yes, all the symptoms are the same, but is it really would like is it really this particular disease, or if it's another one, because there's other factors besides like the actual symptoms that can play, like for example, if a person traveled somewhere, the person's extended family and all of that.
I see. Okay. So that's actually a good segue towards the next question. And Alex, if you want to step in at any moment, feel free because I don't really have a way to include you in this.
Yeah,
But
yeah, I did have a comment to say on that. You you when you asked your question to Sam, told him to imagine a future where AI reaches its full potential and um, maybe beyond our lifetimes when it's perfected. But the thing is, I don't think we can answer that. I mean, we have a medical expert, world renowned, but we don't have an AI expert, right? And even though like ChatGPT, let's say, is impressive right now, I think a problem that people often have is that it has access to all of the internet, and there's a lot of stuff that's absolutely useless or straight up false on the internet, and sometimes it does give just false results. Like experts look up uh, stuff on ChatGPT, and it tells them something that is written on the internet may sound cool, but is just false. So I think at least for now, for sure, and I don't know how far into the future, AI is missing the common sense part. I don't know if that makes sense. Like you could diagnose from those headache, weight loss, more blood, you could diagnose cancer, and that could correlate with the symptoms, but just thinking a bit more and having common sense that humans do and AI currently doesn't. That's a part that's it's missing.
I think infinite processing power kind of beats judgment, but that's definitely a conversation for later. But I definitely understand what you're saying, but I don't think we require an AI expert to tell us about the future of AI. At the very least, I think we require one much less than we do a medical expert, which is why we have Sam today. But for me, you just have to think about what it truly is, right? Okay, it's an intelligence, therefore it can interpret things, compile, store knowledge, but it's artificial. And what exactly makes it artificial? What is the question is what is the biggest difference between humans and AI? To answer your question, I think the differentiation between reliable sources and unreliable sources is very easily imaginable barrier to overcome, because let's say there's a Quora answer about tummy aches and hair loss, and someone user 123 answers, oh, that's probably cancer. So now ChatGPT has access to that information. But then it sees a certain reply from, Sam, renowned doctor, that says this is rubbish. And then ChatGPT can access the entire portfolio that Sam has and know that he is indeed a reliable source. Therefore, that invalidates the initial point that user 123 made, and then
I,
it kind of
I mean,
casts a shadow on core as a whole, right? So it's just through statistical analysis you kind of figure out what is true and what is not, and by
correct me
giving
if I'm
more,
wrong, but
yeah.
professional scientific research sometimes contradicts another
Other.
scientific research.
Yeah, but what I'm saying is, if your feeble brain can understand that now, imagine AI in 200 years. Like,
Sure. Yeah.
of course, well, meta-analyses are a matter of milliseconds, right? That's what it will be. Like, you maybe your best educated guess is something based on a meta-analysis, and how can an AI not compete with that? It will easily do so, correct?
Yeah.
I just don't think that the pedestal we're putting the AIs on is justified. I think we can simply imagine a human being with infinite processing power, but then what we fail to program into it is the question, right? Do we have a fail switch or fail safe? Is that a word?
Hmm.
Where we can kind of like override it in case we become the Matrix, or what else? I don't know, emotions, consciousness, those things. But to me, in medical decisions and medicine, I don't. I guess the biggest question, the core of the first question that I asked is, what is the difference between the AI and the medical doctor that will mostly affect how AI will be used in future medicine? And I think the answer to that is kind of judgment. What do you think?
I I just while you guys were talking, I was thinking a bit like about the differences that aren't exactly completely related to medicine, and it's because I was also like using ChatGPT, playing around with it, and the issues that I found with it, first of all, like I've read news articles saying, oh yeah, ChatGPT is more compassionate than the average doctor, and patients feel better talking to ChatGPT. And it's just like we have to remember that maybe in 200 years there's going to be fully autonomous AI that can actually have feelings, but right now it's not real feelings, right? You're still talking to a program machine. And another thing that, is kind of bad for the doctors but good for society is that you cannot sue an AI if it gives you a false diagnosis and then you end up hurting yourself because you decided to go to an AI instead of a doctor, right? If a doctor does something wrong, there's always the option of suing them, or like because doctors have malpractice insurance, yada yada yada, and that's something that AI can't really do. And another thing is also the plasticity that doctors have with conversations with people, because when I was trying to do like various statistics problems with VAI, it often gave me the wrong answer, and I knew it was the wrong answer because I just wanted to test if it could do it, right? And no matter how I rephrased it, it kept giving me the wrong answer over and over and over, because sometimes it just couldn't exactly see the difference between data points. And like, let's say sometimes it would use a number as a percentage versus as a statistics, and those two are not exactly the same thing, right?
Mm.
And like, let's say that somebody says that 92% of people who had the jab had increased risk of the myocarditis, right? But there's a lot more people that had the jab than people that didn't have the jab. So that 18% that not 18, 8% actually has an increased risk versus the 92%. I'm not explaining it like in detail, but AI still has issues with like differentiating between these two things, and humans do too, but at least a human being can find their mistake and fix it. And AI can't really do that. And before that issue is fixed, it can't really do a proper job with evidence-based medicine right this instance. And another thing is, I was telling you that I kept rewording, and it kept giving me the wrong answer. And it could mean that the AI can just not give a proper answer to this question, but also that I just do not know how to talk to this AI correctly. And so with medicine, right? If you go to the doctor, you don't know anything, and people now want to know more things before they actually see a doctor. But you don't have to relearn how to talk to a doctor to be able to get treatment. But with AI, if you don't know how to properly say uh, your um, your issues, right? The AI might not be able to understand what you're saying, and it's going to keep giving you the wrong answer. And if you're not somebody who already has the knowledge of if it is the wrong answer or not, then you're kind of in a pickle, right?
Hmm.
Because you don't know. You think the AI is correct, but it's just because you don't know how to talk to it. And until like AI can like become more plastic in the way it thinks, and actually the AI is like a human being who doesn't know anything about it, doesn't need to have proper training to actually speak to it, then until then, it can't do as good a job as a doctor.
I see. I definitely think you've highlighted a major hurdle for AI developers in the field of medicine, but in imagining the future of AI, I truly doubt, of course, and before putting it into practice, what you just said is definitely a major problem, but once it will be and it will reach its potential to the fullest, I definitely don't think that will be a problem. And I'm kind of trying to identify it truly far, far, far in the future. But you did mention something very important, and that was one of my questions: is the ethics and the risks involved. Because the first time we do decide, look, this is now the new standard, right? I believe there will come a time, correct me if I'm wrong, but where it's truly, instead of becoming a tool, it becomes really a robot with body scans and sample analyses and a heart rate monitor and a weight scale on it, and you just get on it, you get scanned, and then the diagnosis comes out. And my question is, once something like that exists, and the first time we implement it as an official measure, and it makes a mistake, who is responsible? I think it's a complex, blameworthiness in this aspect is a very complex subject. But could we at the very least make a list of people who might be responsible? First of
Yeah.
all, it might be the AI developer. It could be the people that signed off on its validity. It could be the source of information that the AI accessed that pretends to be valid but is not, right? And it made itself available to AI, for example, for profit. Could you guys think of any other parties responsible?
Well, it will also be the hospital or whatever system there will be in the future if no more hospitals exist, if AI is there. Who actually uses the AI? Well, maybe they would be held responsible, but who knows? Maybe as the world progresses, people are gonna lose more rights, and they're gonna have less representation, and nobody is gonna be responsible, right? It's gonna be more of a use it at your own risk. Who knows?
Oh, I see. Right, it's like the burden of responsibility is on you for buying iDoc with iOS 54.
Exactly.
So, okay. One thing
But
I
yeah,
Yeah, yeah, sorry, sorry.
I was definitely gonna like in all the points Sam made. I think the most poignant one
Of all the
is
points.
of all the points is the like overconfidence because the way AI sees what it does, or like at least the way I understand it, the way it's been described to me is like you have the data, the algorithm that's used to get outputs, and then it's it's a black box. We have no idea what's going on. There's no reasoning. It's just through experience, it's learned that this is the right output. It's trained to give this output with those inputs. And let's imagine that an AI in the future like gets enough certainty, whatever, below 5% error rate to be used. But I'm pretty sure that medicine is so complex that even in 100 years, there's some things that won't have been discovered about the body, right? There'll still be some mysteries that we don't understand and that the AI can't understand because the technology that gave it its inputs and that informed it doesn't know about them, right? So like I don't think it's I don't think we're gonna just find out everything. We're gonna know exactly what the problem is about all the sicknesses. I think it's just gonna be a machine that uses the data we have, and if the data we have is flawed, then it's not gonna know, but it's gonna be like so confident about its results. Yeah, I don't know what I'm saying, but yeah.
I see, because it's the only. I mean, it's the only thing we've given it to operate, right?
Hmm.
I see. Yeah, that's very interesting. And actually, you touched on an important point. I remember in a university lecture, I heard someone promote the mentality that new medicine put on the market should not be tested against placebo and have a significant effect over placebo, but should instead be tested against the gold standard of the industry at the moment, right? So if you want to release a new, headache pill, it should be tested against the top headache pill that exists right now and not against a sugar pill. And you touched on that. You said, if we get it below 5% error rate, or maybe that will give us confidence. But do you guys think that the AI making a mistake means more, and therefore should we simply try to get it below the current doctor's error rate, or should we hold it to an even higher standard because the risks associated and the blameworthiness of it is so ambiguous that we should make so sure that it's extremely valid before releasing it that it's I mean it's going to be much harder than we can even imagine.
But what's so sure? Like 1%?
I don't know. The
0.1%?
thing is, I don't want to name numbers, but do you understand that like when a doctor makes a mistake, it's like, oh well, human error. Well, I'll just consult another doctor. No big deal. But when the
Yeah,
algorithm
yeah, yeah.
that will dictate all future, do you understand how like its universality means that if that made that mistake once, it will potentially make it for all other people in a similar situation, right? And
Yeah,
that's
but
not the case for doctors because everyone is an individual right now.
I think what you just said puts into question if the future you imagine is even possible, right? Because I don't think even with a lot of information you can get it down to a error rate low enough, whatever that is, so that it can be used universally and it'll never make mistakes. That's not possible.
I also just again want to bring the point of like what we see in our society right now. There's various things that we see and how it would affect like if AI was more widespread in medicine, right? Well, right now we see that besides doctors, particularly in the States, there's more nurses that become nurse practitioners, and they just do 2 years of online studies. And most of the time, the degrees, we don't know exactly if they're uh, actually as good as they say they are. And so it gives people more access to medicine. But then what happens is that the nurse practitioners are going to be treating patients that are less well off, so poor people, and what like poor people, right? And then doctors are going to be more treating more people that are more well off, and I feel like that is not a really great thing to happen. And if AI becomes widespread, well, again, for example, in the States, a lot of hospitals are for profit, and so what they want most of all is performance. They want uh, to be able to see more patients and for it to cost less. And if AI exists, well, it's going to exacerbate the problem with for-profit medicine. And so hospitals are going to become more like companies, and because we know of what is happening right now with how companies operate and they don't really care about human beings, right? It's not a gloom thing or a conspiracy thing to think that okay, well, in the future, if AI exists, and let's say that it's perfect, it's there is no margin of error, or if there is, it's really, really low, right? Well, what is going to happen is companies are going to be like, okay, well, if you pay this certain amount, well, you're going to have this probability of it being correct. If you're going to pay this amount, well, you're going to have more coverage and yada, yada, yada. And already it's a problem now. It's going to be even worse in the future with AI. And so, will doctors? You ask like in the future when AI is good, are doctors still going to have jobs? Well, probably yes, except that it's going to be more for the extremely rich, and people that are poor, well, they're going to have substandard levels of care that are going to be like humanly produced, right? Like they could be getting better help, but because companies can, and companies do that now, well, they're going to give them substandard care because if you want better care, pay more. So that is another ethical problem.
Okay, okay. You guys both mentioned error rates, but I'm not. Well, I understand specifically what an error would mean, a medical error would mean. You give a diagnosis that isn't the correct diagnosis, but to me, let's say for you, right, 12, you're going on 13 years of experience. Let's say someone comes to you with a headache and I don't know, and the diagnosis is dehydration. Is headaches are headaches perhaps a symptom of dehydration?
Uh, well, yeah,
Okay,
yeah.
let's just say it's that. Let's simplify it. Let's not even go into the other intricacies. And what you are going to do as a sentient being to diagnose dehydration is that you're going to ask a few questions, you know, to get a better background of the person, and you understand the symptom, and you're going to say, well, look, in my last 40 people who drank only a liter of water a day and came to me with a headache, the diagnosis was dehydration, and therefore you're going to make that diagnosis. Well, an AI is going to do that in 1 second, but in addition to that, is going to run all the questions that you asked against an infinite background. Well, not an infinite, but a larger background. So to me, the mistakes it makes, even though it can be qualified as a mistake, it's going to be much better of an educated guess than a doctor's diagnosis would be. I'm just having trouble understanding what the difference between the error rate of an AI and the error rate of a doctor would mean. Because the error rate of a doctor would be maybe you didn't ask enough questions because you were limited in your time. But perhaps could we attack the essence of what a mistake a doctor makes is, and then the essence of what a mistake an AI makes is?
Well, I don't know. I keep thinking about Dr. House and how, like, I don't know, you get two diseases at the same time that present different signs, and you have to like structure all the symptoms in your head, think of all the symptoms that all the illnesses in the world cause, and then decipher that the combination of these two illnesses together produce this. So maybe like it's too computationally hard for a doctor to do, but it could be possible for an AI. I mean, I don't think Sam was saying that. We're saying that it's plausible that an AI is going to be better than a doctor at what they do, right?
Yeah, at the end of the day, AI as a computer has access to a bunch of information. It will be faster and being able to just give out the correct answer way faster than a doctor. But that is, you asked me in the beginning what it means, like like the different compartments, right, of what a doctor is and what they can do after med school and what a AI can do and after residency also, by the way. But just like looking at the purely medical knowledge compartment, AI is going to always beat doctors, and even now it already is. ChatGPT is having perfect scores on the step exams or yada 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 in the states. So there's really no debate on this particular point of yeah, AI will always be better than a normal human being at just giving it out the correct answer. There's no like real debate here. Obviously, we're talking about like in the future where all the problems that we discussed like have already been addressed.
Right. So if you're telling me they have a better database and then they have a better logic, right? Like a better compilation of, this pattern of symptoms would mean this, and so the way they interpreted this database is better. What is left for humans? Judgment, right? Like looking at the person and simply seeing that that's potentially not what's happening, or it's like if I Google my symptoms, let's compare what Google does right now to an AI, and it tells me, oh, you have this, when I obviously don't. But you, just by looking at me as a doctor, would be like, well, no, you don't have cancer. Your head hurts. Just I don't know, sleep more. Do you think in some sense humans will have the edge on AI in terms of medicine forever in something? Is there something that you could think of? I know, like I'm throwing around the word judgment or emotion, but what does that truly mean? How much of a percentage of medicine is that?
It is obvious, like emotions, compassion, and all of that goes with it is a bigger part of medicine than a lot of people think, right? Because like, why do placebos work? Because people think they will work because they have a feeling it work, yada yada yada. That's why we have to test for medicine if it's actually better than a placebo. So overall in medicine, uh, the emotions are way a bigger part than people think, and the way AI is being developed right now, even if we like go 100 years into the future, 200, we cannot tell right now if it will actually be able to have human feelings.
Right. But excuse me for my crude example, but let's say I'm on the phone with someone and I have to get somewhere and they were giving me directions, or I type in my final destination into Google Maps, which is kind of the AI in this example of mine. I have much better confidence that the AI will get me. Well, Google Maps will get me to my destination through an analysis of traffic and closed roads than the person who's kind of telling me to turn east on something. And I understand why placebos work in the sense that there are multiple factors: the confidence with which the doctor presents it, the strength that is presented, right? Like if it says, oh, mild headache relief versus strong headache relief, that's all the difference. I think, what are the other factors, like with them wearing lab coats? But in a way, I mean, with the development of technology, if you do believe in it and you're not some kind of hippie, it's almost like if you understand the depth of what the difference between the knowledge one person can hold in their head and a computer, I feel like you would have more confidence in the computer, and that it's almost like it's taking the placebo, the human side that makes medicine or placebo so viable, to the extreme, and it almost augments it.
Are we taking it to a point where computers know absolutely everything, including like the emotional parts? Because some like diseases are aggravated by like feelings or stress and stuff, or there's some like psychosomatic causes for diseases, right? Are we talking about a future where you get a blood panel, you get all the hormones that are associated with all the feelings, and it doesn't matter if the computer knows what it is to feel stress, it just knows that according to the chemicals in your blood,
Right,
you're feeling
cortisol,
stressed.
yeah.
Yeah, yeah.
That's interesting. Feelings are definitely, well, wow. Obviously, we're not going to go into the nature of feelings, but I I do believe that in knowing a person, oh, wow, no, okay, I can't even speak on that, but I want to say that emotions are kind of predictable and can be described at least in a general manner, right? But again, they're subjective. But if you know that life event X is stressful for, like, self-reportedly stressful for 80% of people, this person is under stress with this level of certainty, right? I don't think it's unattainable. I don't think an AI can have feelings. I think it can understand it, and that's coming from a person who didn't used to really understand feelings.
Okay,
Okay,
I
yeah,
guess I'm just going there because I agree with you. I think it's like, you know, as Sam said, it passes the medical tests better than humans. It has the analysis, it knows the associations, blah blah blah. But when it comes to psychology, I don't know how far we can stray away from medicine, but you know, like psychological problems, the stuff that psychologists do, is AI gonna get to that?
Yeah, I definitely. I was gonna ask that question specifically. I've had a conversation with our common friend Phil on this, and the biggest concern is that indeed you're playing with, well, not even playing, but you're manipulating and trying to change human emotion without perceiving it fully because you're unable to have it. And let's not derail the conversation about psychology, but maybe Sam, do you have anything to say about like the difference of the jump from AI medicine to AI psychology?
Well, I mean, psychology is sort of part of medicine, right? Because psychiatrists are medical doctors, so it's not that big a jump.
Right.
But it just goes back to like the point that I made earlier of sure, we can teach the AI maybe how to understand human emotion and all of that, but it's really difficult to teach a machine how to interpret human emotions that can be volatile sometimes, right? And the big hurdle would be that it will not be able to understand people that are like let's say in a particular emotional state and or just don't know how to talk to it because like there really needs to be like concrete proof that AI can be like can understand the nuances of not only like getting correct information from the patient but also that a patient does not give you the correct information all the time and like that plays into emotions.
Actually, Alex, if you don't instantly have an answer to what I'm about to ask, we can transition because it's a good transition to another subject. But here's the question: I'm having trouble believing that being able to perceive emotion is required in manipulating others' emotions, aka what an AI would be doing in psychology. Do you think it must be able to feel to be able to kind of give recommendations on others' emotions? Because yes, by a perfect understanding of feelings, maybe you have a certain reply to everyone who comes to you with their problems. But I mean, if I could follow a script for every person in distress and say, "It's not your fault," "I'm with you here. Don't think about right now. Think about it step by step." I feel like you could say that to literally anyone in distress. Okay, by the way, I am working towards a degree in psychology, so maybe we'll erase that if I do graduate. But like it's so arbitrary. Like there are certain
Uh,
universally comforting things that you simply cannot go wrong with. I mean, what person in distress doesn't want to hear "I'm here with you," right? And maybe that feels like a lesser statement when coming from a robot,
yeah,
but
dude,
I don't.
I want to hear Siri say, "I'm here for you."
Well, she's got a kind of a nice voice though.
Yeah, but that's where like I don't think that works because the way I see it is that the psychology part is so much more complicated than illnesses with physical causes that are easily identifiable. I feel like humans aren't even close to understanding the psychology of a human, and I don't even know if an AI is going to be able to do that in the future. How no matter how powerful it is, I think it's not as simple as having a script. The profession exists because it's. I'm also studying in psychology. I think the profession is going to be interesting because each individual case is absolutely different, and it takes an understanding of the person's life to maybe gleam at maybe what's causing the problem, and then it takes a like an adapted approach to every case, and it's very complex. And if a person doesn't even understand themselves, how can someone else or a computer understand the person completely through like what, a couple of questions interviewing the person?
I I also, if you guys let me, just want to add a bit to that of
Hmm.
um You just said a person needs to, like a therapist, right, needs to learn about the person's life to really be able to help them instead of like just giving a script and like quote unquote like patching, like just you know just
Yeah,
putting a
band-aid.
band-aid on it and say okay it's fixed. Well, no, you didn't fix a problem. You didn't even start fixing it. But also an AI always connected to the internet, right? Whatever you tell them to be able to get help is going to be on the internet forever. We do not know exactly who is going to be able to access that information. So it's also about privacy of a person goes to a therapist, goes to a doctor. Yes, the doctors have notes that they write and are like on the internet and shared with others, but a lot of details that maybe aren't necessary to be
Hmm.
there are going to be on the internet, and now people companies have access to your entire life story because you have depression or whatever, and they're gonna use that to sell you. So
Hmm.
I see.
that
That's interesting. But in a placebo sense, I mean, maybe in reality, yes, some people are gonna try to access that information, but in a placebo sense, when I see on WhatsApp, if you guys check it out after a call, it says end to end encrypted, and I trust that thing so much. Like I don't even know what that means, but I just believe in that. So if my AI says, look, our conversations are end to end encrypted, I'm fully there.
It says HTTPS at the beginning of your AI, so you're fine.
So yeah, we have a secure SSL, but I'm kind of torn between the two positions because
Your
Alex
position
says
and our position.
no, no. On the contrary,
Oh,
Alex, you said there is a big gap between psychology and medicine, and Sam just said the psychology is a part of medicine. But what I'm
well,
s-
I agree with Sam. What Sam said, I think.
okay, but let me just like put it
Yeah.
like this: if let's take the most basic problem that you can come to a doctor with, right? Like headaches. Okay, a doctor kind of has to find one of, let's say, 100 possible causes. But if you take a psychologist and you say someone comes to them with depression, the psychologist has to rummage through a million different causes, right? But to an AI, that doesn't mean anything. What I mean through that, by the way, is like, oh, it could be dehydration, this disease, but then with depression, it could be like, oh, this life event, and that's kind of an infinity of those. So it has the complexity of psychology is much larger, and while studying the human body, the macro components are kind of easier to identify. Well, this is wrong with the blood. These are the blood levels, and this is wrong with the blood. And then psychology, I mean, maybe taken to the extreme, it's a perfect analysis and comprehension of the brain, which we are much further from. But the thing is, as you said, Alex, like if you simply give the AI complete access to your life, right? I think Dudesy, the hosts of Dudesy, did that by giving
Mm.
them all of their socials. And let's say the AI can check that in 2016 you were divorced, your relationship status on Facebook went from married to divorced, and you can use that in the diagnosis. Whereas Sam, with I don't know how many clients a day you have, right? You can't learn about their life story. Unfortunately, that's the unfortunate truth about medicine now. So I'm actually kind of on Sam's side, where it's when taken from this perspective of AI, the quest of finding identifying the problem in psychology is much greater than in medicine because we're kind of analyzing at the micro level, but also the information it can play with goes so far beyond. It can download 7 years of your data, uh, in an instant. Whereas the doctor is gonna ask you, oh, do you smoke and how often do you exercise? Well, there's a limited number of things you can do with that.
Okay, but I mean, I'm taking your specific example. Maybe you don't want to use it as an argument, but the fact that someone got divorced in 2016 doesn't mean anything. Some people take divorce well. They needed that and they got away from something that's toxic. And some people take it horribly. They got divorced from. And the AI won't have access to the mental state of the person, their philosophy about life, the way they're thinking about that specific event.
Yeah, but imagine in 2018 you completed a BuzzFeed quiz on your personality type, and it discovers that you have attachment issues, and then it takes that to be your profile. Well, however valid that is, it takes that to be your type of profile, and I'm using this like wild example just to show that the information it could potentially have access to is truly infinite, and it takes that to put it in your profile and consider the fact that all the people of this type react like this to divorces, right? And then maybe it copies your ex-wife's texts and discovers that she is the cause of the divorce and you were kind of divorced from, or however you said it, Alex. I don't know if that was the right way, but divorced of, and that
You were
it
the
could just,
divorcee.
yeah, you were the divorcee instead of the divorcer, and it takes that to make the diagnosis. It's not only about the right. I'm depressed because I was divorced in year X. It's so much more.
I just can't,
But
like, maybe you're right. Maybe with I'll let you talk after. Maybe with that much information it can do something, but I just don't see it right now. Even with specific questions that the psychologist asks a patient, sometimes he doesn't assess the patient well because the patient doesn't assess himself well. And AI will have more limited information than that, and I think it comes back to what I said. It's just if someone has trouble figuring themselves out, how will a computer do that?
Because it won't ask the questions, it will just take the information. Well, look, imagine a fully developed AI. Look, Alex, do you want to give me access to the entirety of your life, but in exchange for that, I'll fix all your problems? To me, it seems like a great deal, especially if it's end to end encrypted. But, so.
Sam?
Sam, please, save us.
the thing is, okay, first of all, AI right now is not open source, right? It's private companies that are developing it. So we don't actually know what, like, for example, WhatsApp, it says end-to-end encrypted, and yet WhatsApp has the entire information about what's inside of it. So it's not actually end-to-end encrypted. If you want something that is actually like end-to-end encrypted, like there's programs like Signal,
By the
right?
way,
Where
drink every time we say end-to-end and encrypted.
all right, all
Sorry,
right.
sorry for the interruption.
Are good. Uh, which is open source, right? So you keep saying you think it's a good deal to just give out your entire life information, but the person solves your psychological problem. Not the person, the AI solves your psychological or your medical problem. But who, like, besides you, right? Does the majority of the population really want that? And is that actually a really good thing to do, to just give out your information, all of your information, to companies that you don't necessarily have the faith in, that just want to make a profit off of you? Like, you asked, like, even if an AI can do everything that a psychologist or a doctor can do, like, do people actually want that? To just give out their entire life information and just become even more of a product than they already are. Like,
Mhm.
people don't like to go to the doctor right now because they don't feel seen. Well, and they say, oh, well, ChatGPT makes them feel more, they feel more human when they're with ChatGPT. But like the way you're describing it, the way that goes, it removes the problem of like the problem we have with doctors now and just places on AI of human beings, which the AI will treat human beings and not machines. Although 1% of the population are psychotic, not psychotic, but psychopaths, sociopaths. They might not really care, but the other 99%, they are still like, they need to have their privacy. They need to feel seen, and that's what the AI will not do in your, like, in the scenario you're describing.
Chris is the 1%.
No, I think I truly am, and maybe we should have an episode on privacy. But I'm thinking like all the things that I don't want, broadcasted on a big screen that I do in my life and in my Google searches are the things that are kind of shady and maybe I shouldn't even be doing in the first place. I don't think like people are a little bit too obsessed nowadays with privacy, and I understand that like no one wants to get their credit card stolen, but if those private companies hear me talking for 7 years, or like listen, their AI listens to the this podcast and understands that I love WhatsApp, and they try to sell me the premium version of WhatsApp on the for the next 2 weeks on Google. Like, I don't know why people are so obsessed. Just use your rational brain. Okay, if you say the word shoe and then the shoe appears on your Google ads, either buy the shoe or don't buy the shoe. The limitations of what they can do with that information they have is, to me, is kind of everything. It kind of determines my whole um, outlook on it, right? Like, I'm not the most private person in the world. I've never gotten scammed or my credit card stolen, but maybe when I say something in front of my Alexa, the next day I'll get ads. Is that the end of the world? But again, that's kind of more of a privacy question. And I understand when you're talking about medical issues, that's very different. If ads start popping up on uh, what's the Blue Chew thing, but the actual one?
What?
Viagra.
Oh,
Yeah, thank you. For Viagra, and someone spots that, and they're like, well, the smart ads
He's
these days.
acting as if he doesn't know what it is.
No, so I really forgot the word, but yeah, I actually have some right in front of me. I just spotted it, but uh, you know what I'm saying? Look, I all of that simply to say, I think it's an exaggeration about the 1%. I think a lot of people, if they could fix their whole life in one click by giving out a part of them, and maybe becoming the product that you described they become, I think it would be a little bit less of a problem than you're saying. But maybe if we even keep stating percentages, if it's 80-20, I'll agree with you. If you settle with me on that, I'll agree, and that is a problem, but it's a little bit of a lesser problem.
well, the 1% that I was talking about, it wasn't like a concrete
Yeah, yeah.
percentage, but like you're saying like privacy shouldn't be that big a deal because like, well, it's only used for if you're doing something shady. But again, if 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 your entire life, your entire medical history is accessible on the internet for ChatGPT or whatever AI in the future to use, and we do not know if the companies what the companies do with all of that information because it will be companies or even a government, and you don't necessarily want to trust the government completely with your entire life, right? Uh, but even things that aren't shady, like let's say I don't know, like something that doesn't necessarily affect your job, but let's say you have a 2% increased risk of having myocarditis, and the AI sees that, right? It's perfect. The AI is perfect, better than a doctor. It sees you have a 2% increase uh, risk of myocarditis. Well, let's say you're working at a company X, right? And or you want to change jobs and you're going to another company, and that new company, right? Well, they might have access to your information. We don't know, like there's nothing stopping the
Hmm.
companies from just giving all the other companies information, and then you're trying to, let's say, get a salary of 100K, and they're like, well, from what information that we have, well, you could die on us and you could just not perform your job, so we want to give you a less a worse like pay. And that's just one example out of infinite ones of privacy is not just for shady things, it's for uh like things that don't necessarily should matter to other people, and we want to keep those things private and not have like that access to literally everyone who pays for it on the internet. And then because of your either psychological history or medical history, well, you might lose on job opportunities. You might not have other opportunities. Let's say for whatever reason you can't get into a university or yada yada yada. That like that's something that doctors will always offer more than AI that is always going to be connected to the internet.
That's a very good point.
I
I
think
agree
that's a
more
very
with
good
you
point. Yeah.
now, because yeah, and it's out of character for me, but I think I had too much faith in the system where that's kind of stuff would not happen. But of course, like Elon Musk has proven to us that he can do better than NASA, right? So obviously the best medical AI is going to be run by a private company. That is like it's self-evident. So and of course they're going to use that for financial gain. Yeah, that's a very good point. So for me, maybe you guys could have some small points. After that, I do have an interesting question, but maybe you guys have small points of on the revolution of research, because imagine every diagnosis and every successful and failed diagnosis becomes part of a larger
Database.
randomized, yeah, database where it's a randomized control trial, but on everything that happens with that AI, right? So imagine they have your genetic profile, your reaction to let's say Adderall, the percentage of effect it has compared to other Adderall users, and then the millions of people who are prescribed that under that AI give out their results, and that becomes part of a larger, well, not even meta-analysis. It's kind of useless meta-analyses. It's just one big randomized control trial where every single diagnosis, everything that happens in the world is kind of a part of this public database that advances science. Do you guys have any thoughts on what that could mean for the rate of the advancement of science?
Yeah, I think all the points about privacy that Sam said earlier apply still, but I could definitely see that obviously very rapidly advancing science. I don't think I have anything to say about it. I think it's a in an ideal world where everyone is good and the AI that people create is good and keeps privacy and everything, it would be amazing. So much stuff is probably missed out on because data is not public for research and there's not enough, not a big enough sample size, and it would definitely make science progress much faster.
Right, underreporting of failures. And Sam, actually, do you know the average efficacy, clinical efficacy of medicine that is required for it to be made public or available?
What do
Like
you mean by
ballpark.
that?
I mean, let's say you have Tylenol, and let's say it's only used as headaches. How many? What is the standard? Is it like one standard deviation above placebo that it has to be to be accepted as a viable headache stopper and therefore be made public, go on the market?
Um, I don't know the exact number, but it does have to, be first safe, right?
Yeah.
It just has to. It depends on the drug or the treatment, but sometimes like it's 99%, right? So like a 1% error, or like uh, that like in the classes that we take, that's as far as we go, but probably in
Well, in the
research.
classes that
Yeah,
your students take.
yeah, exactly.
Okay, really, no, really 99%, because I thought, I remember from my classes that it was much smaller than that, and it kind of just had to be proven to be a little bit better than placebo, enough to be marketed as that.
Well, I'm saying 1%, but like obviously it depends on, for example, how deep into the like how much information we have already, right? If we have a bunch of like drugs for headaches already, right? Maybe f to actually get a new drug that also helps with headaches, well, maybe the margin of error would be a lot smaller. But if it's like a new drug in a completely new field, maybe there's going to be more like leeway.
Okay, I was just gonna make make an assessment of what the AI could mean and like how it could analyze that. Let's say something has to be like 80% efficacious, but that 20% is all people with a certain gene X, and if it had like downloaded all the genetic makeup of every person, right? You give a, let's say to sign up to the AI, you need to give them your DNA, and it identifies that the missing 20% are all people with that gene. How impossibly rapid the advancement of
Right.
medicine would be, right?
Yeah.
Like there's really no debate. Like obviously, if all information is public, if there's not, if there aren't any hurdles, the research is gonna go way, way, way faster, right? Like
Hmm.
if we don't care about the ethics of it,
Yeah.
obviously the research is gonna go faster.
Yeah, like all the unethical experiments in the 1980s they made in psychology, and now we're quoting them and saying, "Oh, it's horrible," but then they make the most advancement about the human brain.
Yeah.
Interesting. So, okay, obviously we've identified that the biggest challenge is setting up what an AI could mean for medicine, but the challenge will not be what it can do for medicine, because once it is set up, right, forget all the ethics, forget all of that,
If it
it will
is.
do incredible things, right?
Yeah,
Yeah.
Is that kind of the
well,
intermediary thing
You
for
said once. I said if it is set up.
if it is set up? Yeah, you're right. You're probably right. These greedy people that want their privacy will never let us set it up. But even if 10% of the world, let's say we do keep normal medicine, right? And 10% of the world become part of this, randomized control trial where every single medicine is logged and their genetic makeup, that is already so much advancement.
Mhm.
Um,
it is, but
yeah.
I feel like you're just not looking at it through the lens of a human being,
I
because
okay.
human beings are not a hive mind, right? If like we evolved differently, if we were more like insects, ants, whatever, this would like go on way, way smoother. But human beings are human beings, right? We're individual monkeys that live in a society, but at the end of the day, like we want our privacy, we want to be seen as individuals and not part of a bigger system. That's the biggest, biggest, biggest issue.
So let's move on towards another
Uh,
question I had, and it was about how people would 110% try to take advantage of AI to get over-the-counter medicine. And obviously, that would involve hackers and stuff like that, but that is much more difficult to predict than without like an AI expert and how easily tricked that can be. But let's just think like rationally. What are the methods that doctors use now to spot people who are trying to take advantage of their ability to give out medicine? And can an AI do the same? I mean, if you learn the script of all the different symptoms you have to have, and then you kind of, I don't know, put fake blood on in a small pouch at the spot where the AI is gonna take your blood out, and then you have all the fake stuff set up, and you want to try to trick it. Do you think it'll be better at doing that than
I think it won't be. I think it can't be tricked, man. It'll be just like the world you're imagining is just you step into a booth
yeah.
which has biometric identification. It scans your eye and your fingerprints and the way you smell, and then it knows you. It takes your blood. It diagnoses there and then Amazon delivers the medicine you need to your house, and that's it.
Okay,
So
but
yeah.
let's say, everything that is made can be tricked because someone who made it also is probably intelligent enough to trick it, right? Let's say you tell me in the 1950s, you tell someone that in the future there will be accounts associated to a certain username, and then those accounts will have secret passwords that are not revealed to anyone. Do you think a person in the 1950s is going to say, "Oh yeah, yeah, somebody was going to be able to hack that password"? I don't think so. They're not going to be even able to imagine what it would mean to hack a password. In the same way, I think, we've seen those futuristic films, right? You put a fake retina on, or I don't know exactly with the blood pouch where it thinks the needle is in your skin, but it's in like a heated blood pouch that is virtually like your skin to the AI. I think anything that can be made can be tricked. If the human mind is intelligent enough to make it, or even ask the AI how do you trick the AI, right? I don't know. I think the extent of the question is a little bit deeper than what you gave it credit for, Alex.
Sure, I can see what you're saying. With new technology emerging, I have no idea what it's going to be like, and it's too complicated for me to understand. And if someone that worked on the booth, the medicine booth, the eye medicine booth, um,
We're
can
not
probably
sponsored
hack
yet.
into
We're
it.
not sponsored yet.
Yeah, yeah.
So okay, so then this question would come back to Sam because in the beginning you did say that you tried to ask the AI questions in different ways, and it always gave you the same answer, and that kind of meant something for you. Well, do you think there's a certain way to just administrate things to the AI that a human mind would be capable of deciphering and telling you, whoa, 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 you kind of have the whole DSM script by heart. You don't have this disease. I'm not going to give you this medicine. Whereas the AI would be like, oh, 100% match with the DSM-5 depression diagnosis. Here's your medicine, right?
DSM
Mhm.
9 at that
DSM-9.
point.
Yeah, pardon.
See, this is where my 155 years of experience as a
Of
pickup
course.
artist and whatnot
Sorry,
comes
I
into
know you're new
play.
to the podcast, but we don't make jokes. You can re-listen, alright? So just
Okay, okay,
okay.
my bad.
No, this is
But
nothing
yeah,
personal. Okay.
yeah, with my background as a pickup artist, right? Like, there's if there's one thing human beings can do better than anything else on this planet is trick people and trick things, and you see it everywhere with video games. People find glitches, right? Because AI was made by a human being. Human beings can be anything made by a human being can be tricked, can be picked, can be whatever. So obviously, yeah, there's always going to be loads of people that can trick the AI versus uh, even some people, right? Even most doctors wouldn't be able to discern that it's actually trickery.
Right. Yeah, but the methods that are used would probably be a little bit different. In the same way where if I wanted to take to fake a urine sample, I would come to you with a fake bag of urine attached to my it feels like I'm speaking from experience, but I just love movies. So in the same way, I mean, the methods are going to be different, but they're going to amount to the same thing where it's like you understand how a person compiles certain information, like oh, retinal scan. Okay, well, here's a different retina.
Mm-hmm.
Okay. Also,
That's gruesome.
yeah, gruesome. Um,
Synthetically created retina, though.
yeah, yeah, obviously 3D printed and
Okay,
everything.
okay.
So the one of the biggest challenges is to overcome, and I think it came up with in my earlier conversation about psychology with Phil, is that ultimately what we trust most in this world are humans, and you're not going to a human to assess something that is vital to you. So, do you think to make AIs more human, we would have to pre-program them with $100,000 of debt and 7 years of medical school and residency?
Sure. I don't really know how to answer that question.
Love
Yeah.
that. So, thank you so much.
Let's say
We
instead of
both laughed. Just
All right,
let's
like
say
you
instead
guys
of
just have to
a
kind of
hundred 100,000, let's say 500,000 for the
have
states.
wow. Let's up the
that's a
stakes. Yeah.
million thousand.
Let's have the stakes and then use that same AI to farm Bitcoin and pay for its own medical debt. So it was a pleasure, Sam. I think we came to certain conclusions. It's a little bit harder to use the figured it out rating in this episode because it's not one specific issue. It's about the future of AI in medicine. But I still think we can kind of come to a conclusion. I'm gonna I'm gonna let you guys say your scores and then I'm gonna say mine.
Yeah, it was great to be on with someone else who's not a psychopath, get another perspective.
I don't endorse that message, but
Well, you're the okay. The figured it out rating, I felt good about this episode, and I think we didn't venture to make any conclusions about something we didn't know about. But yeah, you're right. It's hard to put a figured it out rating on this episode. I think I'm gonna put a 7 out of 10 on it because with our limited knowledge, well, my limited knowledge, Sam has infinite knowledge. There's some stuff I just can't know, but I think the conversation definitely made me think and imagine a future for medicine that I hadn't before. So I figured some stuff out. So 7.
Sam, do you understand what it means to us, the figured it out rating? How much we kind of rounded up well what we set out to do?
I'm gonna I just don't know exactly what for which question are you giving the rating to? Of what exactly did we figure out?
What is the place of AI in medicine, far in the future?
I'm gonna be honest with you, and that's just because of who I am as a person. Maybe in the beginning of the conversation it would have been an 8, but the more it goes, obviously it's a 1 out of 10 because as a lot of psychology or philosophical questions go, the more you question, the more you don't have any answers.
Okay,
So I'm gonna give it a 1 out of 10, I guess.
I love that. Love that interpretation. Very honorable, like your status. So I was gonna say 7 as well, and I love democracy, so we're gonna average 7, 7, and 1. But thank you, Sam. Thank you for your assistance in this episode and your
That's 5.
expertise. That's 5.
Yeah.
All right. I'm in psychology, so I wasn't gonna do the math, but thank you. And so, you guys can follow Sam on his WebMD profile. He posts every week. You can follow us at thinkinbros.com. Thanks a lot, Sam. We'd love to have you back if we're made immortal and the 200 years do happen and we can assist the revolution of medicine through AI and rediscover it with our uploaded consciousnesses over the metaverse.
Thank you.
Thank you for having me.